This is a patient who comes in with abdominal pain, nausea, and vomiting. Got a CT scan with intravenous contrast. We can see immediately there's a small idle hernia. There's some fluid in the stomach over here, which is not terribly distended. And as we start to go down, we start to see in the left side of the abdomen a few loops of bowel that are a little bit distended. Around the mid-abdomen, a few more loops over here that are quite a little bit more distended than they are elsewhere. So let's focus in on these loops, multiple distended loops of bowel. We can see there's a little bit of interloop edema, maybe a little bit of fluid within these loops, and so certainly these loops look like they're in a little bit of trouble. But what's interesting is you follow this loop down over here, we can see that there's an abrupt transition right around this area. It really gets tight over there. And if you follow these loops on the other side, we can see that there is an abrupt transition on this side as well. And so essentially you have a loop of bowel that's distended and that's obstructed at 2 points that are adjacent to one another. In between you have fluid and edema. These findings are classic for a closed loop small bowel obstruction. They're prone to get ischemia, prone to become infarcted if not treated appropriately. This ended up going to the operating room, indeed, had a closed loop small bowel obstruction.